Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about same-day knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. Same-day knee replacement surgery, or you may hear this referred to as outpatient knee replacement or ambulatory knee replacement surgery, is essentially you're having your knee replacement and you're going home that same day that you have the surgery. So basically, in most cases, you go to the hospital or the facility probably pretty early in the morning. You have your surgery sometime in the morning, whenever it's scheduled. You're usually hanging out at that facility or that hospital, that outpatient facility, for a couple hours or so, just to make sure that everything looks good after your surgery. You're coming out of the anesthesia okay. There's no complications or no concerns that they have to be aware or be concerned about. And then they send you home. Obviously, having someone there to drive you home, so a family member, a friend, whoever that may be, and you are at home now. So you don't have to spend a night or multiple nights in a hospital. You don't, in most cases, have to go to an inpatient rehab facility. And a lot of people, of course, would prefer this. They'd prefer to be home, where it's comfortable, where they feel comfortable and calm and relaxed. They can try to sleep a little bit. They can try to rest a little bit after having, a pretty intensive surgery. So there's a lot of benefits to an outpatient surgery. So what you want to think about, a couple of things, is one, it's not for everyone. So a lot of times this is going to be for the folks who are a little bit younger, a little bit more, in good health, physically fit, physically able to manage rehab and recovery, and are likely to have a good outcome and a good recovery, an efficient recovery after surgery. If you're someone who may be a little bit older, a little bit less mobile, if you're someone who may be at risk for having some complications, maybe you have a history of cardiac congestive heart failure or something of that nature, maybe you have a history of blood clots, whatever that may be, you may be steered away from getting an outpatient surgery just because they want to make sure they're monitoring you and keeping a good eye on you in that first day or so after surgery. So they might recommend staying in the hospital more so for an individual in that case. But again, it's getting more and more prevalent that a lot of these surgeries are on an outpatient basis because we're finding ways that, going home, even if you do have maybe one or two risk factors or something of that nature, the risk of having any complications or any increased issues by going home seems to be relatively low. And of course, you're still in contact with your surgeon's office, contact with your doctor. They're getting you set up with home health therapy or some form of physical therapy, right away as soon as possible to get you on the rehab and recovery process. So it's not like they just send you home and say, see you in 6 months for your a checkup or a follow-up. It's, you're still being monitored. You're still in contact with your healthcare providers. So some other things to think about is who is this right for, is you really have to be someone who is invested and playing an active role in this process. Knee replacement surgery is an active, involved process if you want to have the best outcomes and the best recovery after surgery. So you're someone who, you take advantage of the education and everything before surgery, and you prepare for surgery. You prepare your home, you prepare yourself physically, maybe doing some physical therapy. You prepare yourself mentally and emotionally, and you're ready and you're going to be active in your rehab process. So it really has to be someone who is proactive and takes that initiative if you're going to have a good outcome. Because again, we're sending you home. So we still have that contact, but you are going to be home, and there is a little bit of that, taking on that self motivation to continue your rehab by yourself. And just it's to think about what are some of the benefits of going home. Well, there's decreased risk of issues of being in a hospital, hospitals, you can get infections, you can get illnesses, you can have issues in the hospital. So you're decreasing that risk as much as we possibly can. And again, like I said, people just enjoy being home rather than in a hospital for 2 or 3 nights. Some things to think about when you're discharged is you want to make sure that you have a plan for pain management. And what I mean by that is multimodal, so different modes. So that's your medication. That may be an opioid or prescription medicine. It also might include, or most likely include, acetaminophen or Tylenol, and possibly also an anti-inflammatory or an NSAID. You also want to think about, like I was saying before, are you prepared? Is your home prepared for coming back? So having a good setup for your bathroom, for hygiene, for using the toilet, making sure you have a good setup for your bed, maybe putting it on, sleeping on the first floor. If you have a 2-story home, having a first floor setup, at least initially, until you're more comfortable going up and down the stairs, things of that nature. And make sure you're set up for whatever is next. If that's home health therapy coming in, if that's an outpatient physical therapy, in some instances that's managing your therapy on your own, following the exercises and instructions from your surgeon's office, and doing that by yourself unless there are any issues or concerns come up. So really being aware of being prepared for this will allow you to have a great outcome and a great recovery after knee replacement surgery. So that's a little bit of details and explanatory information about an outpatient or a same-day knee replacement surgery. I'd love to hear if you have any questions. If you're someone who had a same-day knee replacement or an outpatient surgery, I'd love to hear your comments and your feedback below. Again, please be sure to hit that subscribe button so you can watch all of our latest videos. And as always, please be sure to hit that like button as well, as this helps spread the video to other viewers. I thank you very much for watching.